Thank you, Dr. Neha Kakar. Good evening, good afternoon, and good morning. This is the 1673rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Sumana Kumari Panda. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends. And the purpose of this forum is to take homeopathy to every house around the world. And it is your duty to share and subscribe the same without wasting a single minute. That's what I would like to request. And we welcome all to the session. And today, you all know that today our guest is Dr. Sumana Kumari Panda, MD in Homeopathy. She is a retired district medical officer from Cuttack Circle, Health and Family Welfare Department, Odisha. She is a consultant at Jabaleshwar Homeo Clinic, Cuttack, and Chaudhar, Odisha. She has more than 35 years of clinical experience in treating chronic diseases and particularly obstetrics and gynecological cases, palliative care, cancer cases, etc. And she has an experience of 18 years in the teaching field and in the Department of Medicina Medica at Dr. Amin Chandra Homeopathic Medical College Hospital, Bhubaneswar. She's a research person. She has worked as the principal investigator in collaborative research projects under CCRH, Government of India, efficacy of homeopathic therapy on duration of labor. She's a resource person in various inductive training skills, development training, reorientation training, etc. She has done awareness program for HMOs in community organized by CCRH New Delhi and Health and Family Welfare Department of Government of Odisha. She has presented scientific papers at national as well as international homeopathic seminars organized by Liga, IIHP, Research Society of India, Andhra Pradesh Homeopathic Association, Tamil Nadu Homeopathic Association, and many other organizations in Odisha. She has published some articles on peer-reviewed journals, IJRH, etc. Awarded the best homeopathic of Odisha Hanuman Palliative Seminar in 2014 by Homeopathic Board of Odisha, Best Homeopathy Award COVID Warrior by Mawarwad Mahila Samaj and Women Inspiration of by Lion Club, and Best Women Society Worker by Odisha Nari Seva Sangh Kathak Branch, and Bharat Homeo Ratna by Welfare Homeopathy, etc. Served through the Lions Club International as diabetic chairperson to create diabetic awareness throughout the Odisha and received most prestigious international presidential medal in 2018. Dr. Sumana Kumari Panda has presented so many papers in both our Hindi as well as in English sessions. And today, Doctor will be presenting an important subject, study of bowel nosodes. It has 2 parts, and the first part will be discussed today. As you all know, bowel nosodes are one of the best medicine that can work for in between when a constitutional medicine is given. And let us see what our guest of the day, Dr. Sumana Kumari Panda, has to say about all these things. Welcome, madam.
Namaste. Thank you, Dr. Dhanesh, for a long introduction. Really, it's not needed so much.
You really deserve it.
So thank you, thank you. So at the outset, I am very much thankful to the organizers of IFPS that they have given me a scope to speak on various topics. And today also I am entering into this study of bowel nodules. And thank you. When I joined, I became very happy that the attendant of my patient joined, Mr. Kumar Naik, joined our session, and perhaps he was sharing his experience of his wife. Really, his wife, I have asked him that can you join for 2 to 3 minutes, because his wife was suffering from secondary infertility for last 5 years, and he has visited many gynecologists within that. And first one, when she conceived, that was a miscarriage, and after that she didn't. So what happened? She has undergone HSG, and with that they found that she had bilateral cornual block, fallopian tube block, and along with that she also had PCOD problems, PCOS problems, and I think serum prolactin was also too high in that case. So a complex disorder she had, and due to that she had infertility. So in a state of depression, we can say, both the couples met me, and I continued treatment for 9 months, and the lady conceived with a bowel nodule psychotic compound 200. So that's why, as today's topic is on bowel nodule, I asked him, can you join and can you share your experience with psychotico? And I am very much grateful to him that he joined today. And Nayak Babu, bahut dhanyavad. And his wife again had the uh, bleeding for vagina in early months of pregnancy. Really, she is having, I think, 7 or 8 weeks of pregnancy continuing now. So just recently she conceived. And in first trimester only, by 5th week of gestation, she had bleeding for vagina. And that bleeding was controlled by Arnika. While talking, if the sessions permit, the organizers, if they will permit, in future sessions, I will discuss. Today, I will go for the theoretical portion, the history of bowel nodules, and how that was came into light, and how the experiments were taken. And I will focus on those things. But an introductory part, I will take 2 sessions if the second session will be permitted, and next sessions will be on individual bowel nodule drugs, so that I can discuss. So while discussing the psychotic compound, that case I will discuss in detail why I opted for psychotic compound. But primarily I have opted for the constitutional remedy. I think the case started with sepia, next followed by Thuja, and next followed by psychotic compound. So that was continued with a psychotic compound, and she conceived with a psychotic compound. That's why this is the essence of bowel nodule. We can rely upon the bowel nodules. Why I am speaking like this? Because even if today many of the physicians are not using bowel nodules, bowel nodules are not very commonly used drugs. Even the proving has not been undertaken in Hahnemannian method by human proving drug like our other drugs. But the clinical proving sick proving has been done on bowel nodules, and the really very limited literatures are present, and limited doctors are also prescribing nowadays. I think everyone will agree with this. the bowel nosode prescription is in comparison to others, or even if today it is less. So that's why I thought let me discuss on bowel nosodes in detail. I will go. So I will go in detail today. So I'm sharing my screen to start my PowerPoint.
Yes. Okay.
Really, the assistant told that the new patients are in.
It's fine. Everything fine. You can go ahead.
Sorry for disturbance. So my topic is on bowel nodules. Introductory part I will cover up today.
Network problem is there. Is somebody, madam, you can say something on that. So there is so. Yes, our doctor is joining. Madam is joining again.
Sorry, Dhanush, I have not prepared about this bowel nosode. That is.
Okay, we can see the.
It is a very good pleasure to see that Sumana Kumari Panda's patient came in the platform and he was telling the results of his white treatment. Really.
Sorry. Again, some problem in happened.
Network.
So
Okay.
again, I am sharing my
Yes,
screen.
restart again. Okay. Okay, now history of bowel nodules. Okay.
Okay.
Or
So
what?
before going to the bowel nodules, we must discuss what is nosode. So as we know that nothing goes waste in nature. What is waste for someone is a valuable, blissful product might be when it is attenuated homeopathically for a sick person. So this is nosode because nosodes are the disease products. They are prepared from the pus, from the body fluids, diseased fluids, from the diseased tissue, like that. So that is the worst product for the diseased, already suffering man. But when homeopathically attenuated, that becomes a blissful product for a sick person. So that is nosode. If we will go to look at the Dorland's Illustrated Medical Dictionary, which defines nosode as any disease product when used as a remedy, that is called nosode. And but in a homeopathic point of view, if we will say that a nosode is a medicine from the disease products of animals or human beings through a specific method, that is potentization, in strict adherence to the doctrines of homeopathy, may be applied. These nosodes may be applied for both prophylactic purpose and curative purposes in various disease conditions. What is bowel nosode? Next is what is bowel nosode? So bowel nosodes, as the name implies, medicines prepared from cultures of non-lactose fermenting bacteria who reside inside the intestinal tract are called intestinal nosodes or bowel nosodes. They are disease products, but exactly not the disease products. Why Dr. Y.R. Agarwal said like this? Because they are symbiotic to human beings. The intestinal bacteria, they reside inside the bacterial flora of the intestine. They are very helpful for us. Okay, they help in absorption. They are of the food. They help in assimilation of the food. They are helping in metabolism. So in many ways, they are helpful to us in a healthy condition. But when someone becomes diseased, or if the intestinal flora becomes diseased, in those conditions, the habit and the biological changes and the biochemical changes, exactly we can say the change in biochemical level, change in habit, change in functionality, change in number also we find inside of these non-lactose fermenting germs inside the intestinal flora. So they become diseased in that condition. In healthy condition, the number is very less. Their functionality is good. In diseased condition, the number rises, biochemical changes occur there. They, their functionality reduces, and the disease organisms are organisms, intestinal organisms are known as diseased organisms in that state. So that's why when a person becomes diseased, if we are collecting those germs from the bacterial flora, and in a laboratory investigation, it was found that they are diseased. The healthy germs become diseased germs, and the preparation of the medicine is from those germs only. That's why this can be termed as a nosode according to Y.R. Agarwal, and as those are found in the intestinal flora, those are known as bowel nosodes. This can further stressed as the medicines prepared from actual disease secretions or products or from disease associated organisms in culture or subculture form inside the laboratory experimentation. The bowel nosodes are usually gram-negative bacilli of the coliform group, except the psychotico compound, which is a coccus. Others are bacillus. They are differentiated from each other on the basis of ability to ferment certain type of sugars. So when a certain, what John Patterson has done inside the laboratory, they have isolated and then cultured in agar media the bacteria, and then they added certain type of sugars to the different bacteria, and the reactions were studied. So according to those, they are differentiated. Some are Salmonella, some are Proteus, some are Shigella, but the maximum number found are E. coli or B. coli. So while coming to the history of bowel nosodes, we should remember Master Hahnemann. So Master Hahnemann is the father of bacteriology actually, but as the modern science knows, Louis Pasteur, he have found bacteria for the first time, but he didn't found. He isolated and identified bacteria for the first time. But the concept came from Hahnemann many years before Louis Pasteur. Louis Pasteur's work. So Hahnemann conceptualized that the diseases are produced due to derangement in vital force depending upon the individual susceptibility to morbific influence. This we know. This statement again, he has stated that bacteria viruses are not the cause of the disease. In our organon already we have covered up, rather the result of the disease. So this intuition again reflected in his article entitled The Mode of Propagation of Asiatic Cholera, which he has published. There he has written that the excessively minute invisible living creatures. So this means excessively minute invisible living creatures so inimical to human life. So that he means about the germs, viruses, bacteria, protozoas, like that. So in ascitic cholera, he was meaning Vibrio cholerae. So his point was to say that. So that's why the bacteria which is responsible for causing ascitic cholera, he means Vibrio cholerae. But he has not isolated, not identified the germs. That's why Hahnemann's name didn't came in future days, and the Louis Pasteur name came forward. So after Louis Pasteur, the bacteriologist, then came the Cox. Louis Pasteur declared that he created a standard, and he declares that any pathogenic germ. That means the germ which is have capability to cause disease can be termed as a pathogenic germ. So the diseases are caused due to germs. So this concept came from Louis Pasteur. And that statement followed up by Koch. As we know, the tubercular bacillus was found by the Koch, and after his discovery, the all the laboratory investigations, experimentations carried out to find out new germs, new bacteria, which are causing cause of the disease. In 1880, during early investigations of intestinal microbiology, Everth, he is also a bacteriologist, isolated and identified large number of gram-negative bowel organisms which have either little or no pathology. And chief organism he found, as I told, E. coli, and the other organisms also he found responsible to cause disease are the salmonella, which causes typhoid, paratyphoid like that, and food poisoning also enterobacter like that. He found Shigellosis, Shigella also he found, who is causing food poisoning. So these intestinal organisms are now identified as Klebsiella. Other intestinal organisms further again identified as Klebsiella, Proteus and others. Next, coming to Dr. Edward Bach. Edward Bach, 1886 to 1936, he is a bacteriologist in University College Hospital, London. And he discovered that he worked a lot on the bowel nosodes, and he discovered that certain germs belong to non-lactose fermenting gram-negative coli typhoid group had some specific connection with the chronic diseases and its cure. So this concept has Edward Bach has found out that the germs in the bacterial flora, mostly non-lactose fermenting gram-negative coli, bacillus, they have some relationship with the chronic diseases of and also relationship with cure. So both the way he has found out first. These germs present in the healthy individual and also in diseased individual. But in latter case, in diseased individual, they are pathogenic. He isolated the germs, and he at that time the vaccine therapy was in rampant use. So he started forming vaccines from those isolated germs and prepared from the killed organisms. He prepared vaccines and he administered first the vaccine therapy to the diseased individuals, and he cured some diseases. So those are autogenous vaccines. And he claimed that in latter state, again, he potentized the vaccine. That vaccine was potentized, and according to homeopathic principle, he administered to the sick persons. So many patients he has treated. First article he has written treating 500 cases on different diseases. So Beck resigned in 1918 and joined London Homeopathic Hospital as a pathologist and a bacteriologist. But before that, before joining in that homeopathic hospital, in that homeopathic hospital, he came in close contact with organon of medicine. He read organon of medicine, and ultimately he found that many similarities in vaccine therapy and homeopathic treatment. He was potentizing the vaccine therapy and administering to the sick people, and he read the similia similibus curanda, how to apply with these similar symptoms. So basing upon these concepts, he administered the vaccine therapy to sick persons, and he had he found that the sick persons are cured with that therapy. So vaccine therapy principle warrant the belief that if disease symptoms disappear or are much ameliorated after the use of vaccine therapy, but that particular organism, um, then that organism counts at least something, contributes something for the production of disease, he found out. Okay. Next, he in laboratory, he has undergone the experimentation inside his laboratory. So what he did inside laboratory, Beck tried to establish the relationship of the non-lactose fermenters to chronic disease bacteriologically by examining the stool samples of the patients before treatment and after treatment. So both the way he collected the stool samples and he cultured those stool samples. So so during culture, after administration of the autogenous vaccine, which was potentized. So what he found? He found that the organism number is less in the very beginning before treatment, but after treatment the organism number, the biochemical changes, number increased and the biochemical changes also he found there. So that might be, and in patient also symptomatically he found little bit aggravation, but the patient says I am feeling very well. So feeling of well-being associated with little bit aggravation of the symptoms, and simultaneously in laboratory the increased number of the germs and the biochemical changes of the germs, from which he concluded that this treatment procedure is similar to the homeopathic treatment procedure, and this vaccine therapy after potentization can be used as the homeopathic medicine for the sick persons. Okay, basing upon the principle similia similibus curantur. So this was his finding, and the organisms will be found in large number during all the earlier months of the treatment, and he concluded that this might be due to the formation of disease inside the body, artificial disease, disease due to medicine which was administered. So he concluded like this, because the organisms are, original disease was 10 to 14 days before, which was the latent period, or we can say the incubation period, after which inside the laboratory the germ numbers increased. That's why he concluded this germ number, when the patient is feeling well-being, when the symptoms are little bit aggravation followed by relief, improvement. So in that case, why the germ number increased and the biochemical changes were taking place? So that might be due to the artificial disease created by the medicine. Beck's other observations were, following a vaccination, the patients reported a brief aggravation of their symptoms followed by conspicuous improvement. Number two, such improvement was marked by an increased sense of general well-being, which continued for long periods without further treatment. Number three, he found patients reported continued relief more consistently if vaccines were employed less frequently. So again, he has indicated some therapeutic guidelines to us that the repetition of the dose is to be avoided, even if in bowel nosodes. Okay. So just like other homeopathic constitutional remedies. And again, another indication also, therapeutic indication he has given to us, that is small initial doses and long intervals between two doses. He has advised us, guided us. And the number 3 point he has indicated, that is the patient, when the patient is improving, there is the reappearance of the old symptoms for a brief period, followed by disappearance. So all these points are very much corroborating with the homeopathic principle. So that can be used. So that although sick proving was there, no healthy human being proving, but the results are the, even if from the lab experimentation, those are corroborating with the homeopathic principles. In 1919, Beck spoke before British Homeopathic Society to suggest that the toxemia resulting from the non-lactose fermenting bacteria was virtually, they are corroborating with Hahnemann's spora. So this is a big thing. It's a very good concept he has spoken in Homeopathic Society. He potentized the vaccine and administered them orally between 1920 to 21. Okay. Upon Beck reported a series of 500 unselected, randomizedly selected cases. So cases
Madam, madam, the PPT is not moving.
you can't see the PPT.
Yes, history of bowel nodes is still there.
Others you can't see.
Yes, yes, yes. But it is not history of bowel nodes heading itself.
Oh, what happened then?
Now, okay, now you can go ahead. Okay, now we can.
Can you see now?
Now, okay, it's moving now.
Okay. So it is corroborating the Hahnemann's spora. He found the toxemia results, and he potentized the vaccine and administered them orally, as I told you, 1922-21. And finally, after 9 years of experience, he reported 500 cases. According to his report, 95% cases show favorable results, and in 80% excellent results. Okay. So Beck observed results are so striking that it is very difficult to resist the this concept that the organisms are related to diseases as the cause and the effect. As the cause also related and as the effect also related. So this effect is coming from the Hahnemann's concept also. So in 1925, Dr. Batch and Wheeler wrote their book Chronic Diseases, a Working Hypothesis. So after this, it came to notice that, so after publication of this book, only the others thought that E. coli can be the intestinal flora germ, E. coli, Escherichia coli can be harmful. Otherwise, beforehand, it was in a concept that this is very harmless, saprophytic organism. But after this publication of this book, the concept came that this can be harmful. At 9th Queen and Quell International Homeopathic Congress held. So in that Congress, Wheeler and T.M. Dashington presented an introduction to the use of vaccines to homeopathic community. So how the vaccines can be used, they have presented for the first time, presented this paper in International Homeopathic Congress, okay, European Society. Beck focused on the points and results are obtained by potentized preparations of killed organisms. First full preparation of clinical proving was done in 1929 by Thomas M. Dashington. So for the first time, the clinical proving was done by the Dashington on dysentery compound. The proving of bowel nodules are not conducted in the strict Hahnemannian format. Already I had said many times. That is the healthy human being proving. They are clinical observations of the sick persons. In 1930, Beck briefly summarized clinically derived indications from nodules, and in 1928, Beck lost interest on bowel nodules, left London in search of herbal treatment, and eventually he developed backflower remedies. So in between, Dr. Edward Beck left the proving on the work on bowel nodules. Just as we know, the tuberculinum lives in between and goes and shifts to another. So he might be the tuberculinum in my view. So you can analyze more further. But the work further was taken over by his co-worker John Patterson, a Scottish physician. He concentrated on his research from 1928 for further 30 years. He added much more to the bowel nodules. He studied the characteristics of the bowel flora in healthy human being, in diseased conditions, and what are the functions of the bowel flora in our healthy body. And he examined more than 20,000 stool specimens in the laboratory and conducted research on these stool specimens for 20 years, over 20 years. And his conclusions were he added many symptoms to the individual bowel nodules. He has worked on the stool cultures, how the stool culture, the habit, their characteristics are changing during healthy condition and the diseased condition. Of course, Dr. Edward Beck also found out many characteristics, but John Patterson added many more characteristics to them. His major conclusions were the non-lactose fermenting, non-pathogenic bowel flora, the specifically B. coli, because B. coli covers the most frequently found organism in the bowel flora. B. coli undergoes definite changes in the disease condition. While this alternation in the nature of bowel flora, which might be the concomitant to the disease condition. So when in healthy condition, the nature of characteristic of bowel flora, the characteristic of nature of the germs where the B. coli was different. But when the person becomes diseased, the nature of the B. coli changes inside, even if inside the laboratory, what he has observed. So while this alternation in the nature of bowel flora might be the concomitant to the disease condition, what he concluded, here is a reason to believe that the B. coli is the pathogenic bacteria. Otherwise, the changes might not be taking place. But even if today the modern medicine system says that B. coli is the cause of the disease, for disease caused in the intestinal flora, but actually when the person becomes diseased, John Patterson also told that the person becomes first diseased, and after 10-14 days of the disease condition, the nature of the organism changes. Means that might be due to the artificial disease created by the homeopathic medicine previously administered. The balance of the bowel flora is disturbed in disease, already discussed. Similar changes are also observed in drug proving. Drug proving means sick observation. So Patterson advocated specific recommendation on potency doses on bowel nodules. He related each of the bowel nodule to a group of homeopathic medicines. What we type the most related drugs or the most related one we say prototype. As the psychotico compound is the prototype of Thuja, and because most of the symptoms of Thuja are common with the similar with the psychotic compound. Just like that, Morgan Gartner, we find the prototype is lycopodium. Morgan Pure, the prototype is sulfur. So Decentrico, the prototype is arsenic. So, so we can discuss like this. The Gartner, the prototype is phosphorus. So under individual drugs, we will discuss in detail about the bowel nodules. About while discussing in the session of psychotico, we will discuss in detail. So Beck found out the non-lactose fermenting was closely related to the symptoms which are collectively called as sora by Hahnemann. But Patterson told the gram-negative diplococci were directly related to the psychotic miasm. So Beck found that some symptoms, he has not done so much experimentation, like with the number of experimentation were more with Patterson than Beck. That's why Beck told some symptoms while the experimenting upon the Morgan group. Mostly Morgan group was experimented by Beck, and he found that the Hahnemann's sora is related to this. But Patterson found that the gram-negative diplococci like gonorrhea, gram-negative like Neisseria gonorrhea like that, but that is not found here in intestinal flora. The gram-negative other diplococci like psychotic compound were directly related to the psychotic miasm, what he has concluded. He grouped and typed the flora by continuous experiment, and he was able to detect a definite relationship between certain type of organisms and a certain type of bowel flora. When particular drug was added in a particular potency, the bowel flora was altered in a particular way. So this is also corroborating the homeopathic principle. He divided the Morgan group. Beck told only Morgan group, but John Patterson subsequently divided Morgan group of bacteria into two subclasses, that is Morgan Pure and Morgan Gartner. In 1933, Patterson presented a paper before British Homeopathic Society on psychotico, and in 1950, he published summary of his accumulated experiences of all the bowel nodules. His vast experience he has written in his summarized and published in 1950, in which he has many facets. He has incorporated the background of bowel nodules, the concept, bacteriologically derived indications of bowel nodules, clinical indications of bowel nodules, the guidelines for selection of potency, how to select a proper potency. In next session, I will discuss on those, and the repetition schedule of the medicines also he has discussed. So as Beck has also told that the repetition should not be so early. So it will be in 3 months distance. Okay. So in 3 months interval that will be repeated. All these things were summarized by John Patterson. In 1936, Patterson presented a paper in British Homeopathic Society on potentized drug and its action on the bowel flora, which dealt with the 12,000 cases. He has experimentation and published in homeopathy, which was in 1933 April 1936 in a homeopathic journal that was published. The summary was B. coli can be isolated from the intestines of all warm-blooded animals. It is a harmless saprophyte and is non-pathogenicity in healthy individuals. The function of B. coli to break up complex food substances into simple substance. Any change in mucosa of the bowels is followed by a change in the bacterial flora. B. coli behaves differently in diseased organism and its biochemistry changes. Non-lactose fermenting bacilli were isolated in 25% of the stool specimens examined, but in 75% the medicine was prescribed basing upon the symptom similarity. The appearance of non-lactose fermenting bacilli often followed and seemed to be due to the previously administered homeopathic remedy, the choice of the remedy being made according to the law of similars and prepared by potentization. The non-lactose fermenting bacilli which appeared in large number administration of homeopathy remedy were of the typhoid and paratyphoid type. Instead of increased suffering from disease, the clinical investigators found that patient experienced a feeling of well-being. It is further concluded that if each germ is associated with its symptom picture from the clinical and laboratory findings, that the specific organism is related to the disease, the specific organism is related to homeopathic remedy, the homeopathic remedy is related to disease. So these are the concluding remarks of John Patterson. So after John Patterson, after the death of 1954, his wife Elizabeth Patterson continued research on this, and in 1959 she presented a paper entitled A Survey of the Nosodes before the European Homeopathic Society, based on the summary of symptoms of 330 cases treated with bowel nosodes. And that study really, after that, the study is not continued in vivid manner, very slowly, and the literatures are not added so much to the bowel nosodes. So this is all about the history and about the repetition schedule. Names of the bowel nosodes. So mostly 9 types, usually 10. Cocalco is not added here. 10 types of bowel nosodes are now. Morgan Gatner, Morgan Pure, Psychotico, Dysentrico, Proteus, Mutabile, Gatner, Icalis is also there. Bacillus number 7, Bacillus number 10. Icalis. Icalis is not mentioned here. So 10. Thank you for today's session, for the introductory part. And if Dr. Dhanesh, can I discuss 3-4 minutes about the dose?
Yes, you can speak because there is no need for further discussion since we have another session coming, so that you can.
So about the dose and the repetition schedule, I will discuss that the dose always John Patterson has guided us that the bowel nosodes are usually prescribed in like nosodes. Where to go for bowel nosodes? If we will think, just like many points are there, just like nosodes, we can use when the indicated remedy fails to cure or partially cures. In those conditions, we are shifting for a nosode, and in the same situation, we can shift towards a bowel nodule. Number 1 point. Number 2, when after taking a thorough case history, we have to go to the past history also. What was there? So, and the presenting complaints. So, basing upon a thorough case taking will be done. So, after that, if the similar drug coming is a bowel nodule, then we can go for a bowel nodule. in that condition. Number one, if most simillimum becomes the bowel nodule, after thorough case taking, we can go for a bowel nodule. Number two, when the indicated remedy fails to cure completely or there is a standstill mode. So in that case also we can go for a bowel nodule. Number three is very important. When after a thorough case taking, we can't decide that whether to go for sulfur or to go for calcarea or to go for graphitis. So in that situation, if we can't decide, we can go to the bowel nodule Morgan cure. So in those conditions also we can think of bowel nodules. Number four, basing upon this stool culture, if a specific organism is found and the symptoms are corroborating to a particular bowel nodule, in those situations also we can go for a bowel nodule prescription. So in these conditions we can think of bowel nodule prescription. About the dose and repetition, again Dr. Patterson has told that this should be used in higher potencies, usually in 30 and above, not less than that. But when if we are getting too many in culture, stool culture, a large number of germs, not large number of bacillus or cocci in stool culture, in those cases, not to go for bowel nodules. He has advised. But if you have to go for a bowel nodule, no other drug is indicating in that case, Patterson has advised to go for the lower potency like 6C potency in centesimal scale. He has advised. Otherwise, usually go for bowel nodules in higher potency, normally 30 and above. And I have seen in my practice that 200 and above I am prescribing, 200, 1M, 10M like that. And nowadays millesimal scale also come, that is working very good, very well working in that case. And repetition, John Patterson has told that after 3 months you have to repeat a bowel nodule. Suppose he has told, but again another guideline also he has given, that suppose in a case after 3 months you will repeat the centesimal scale, but in millesimal scale you can repeat more earlier in bowel nodules. Otherwise, we can say that he has advised that along with the bowel nodules, if the patient is in acute condition requiring a acute drug in that condition, so you can go with suppose you have given Morgan Pure 1M today, and after 7 days you can go for a acute drug in a lower potency with frequent repetition to control the patient. When the acuteness covers up, after that you stop acute medicine and continued with infrequent repetition of the bowel nodule. This is also the guideline of John Patterson. And this is working, really a very good working in this state. And but millesimal scale I am using in alternate day repetition, 4th day repetition, like that. So this is about the repetition schedule, dose, and where to go for bowel nodule. Another point I must focus that as we all know, we all are clinicians and we all know that when the prescription of the remedy is again on the pace of the disease. Pace of the disease, intensity of the pathology is very important for going to the remedy selection. Vegetable soup, first we know the first level is vegetable kingdom. More deeper the pathology, animal kingdom. More deeper the pathology, chemicals and metals. More deeper the pathology, nodules. And more deeper the pathology, bowel nodules. So bowel nodules are very good drugs in case of deeper pathology and very difficult cases. And as in the beginning, my patient's husband attendant told that a case of bilateral corneal block, fallopian tube block associated with a PCOD. She was suffering for 5 years and treated with many gynecologists, but in
Yes.
time, but she didn't conceive. So after
Yes.
psychotico compound 200 prescription, she conceived, and now she is continuing her pregnancy. So this is a very good thing to be seen with bowel nodules. So my point to focus on bowel nodules in very difficult cases, very difficult pathological cases. Bowel nodules can be prescribed very easily.
Yes, yes, madam. Thank you very much for an excellent session in this evening. And I'm inviting, since there is a second part coming in the next month itself, so we can have discussion on the subject later on. So it is the time
Thank you.
wind up the session. I invite Dr. Mariama John to say a vote of thanks to the.
Congratulations, doctor. On behalf of IFPH, I thank you for a nice presentation. Please come again with this second section. Thank you, doctor.